Thank you for watching the Atkinson Gazette. I'm your host, Michael Boucher. SoRock Coalition for Healthy Youth is a program that serves Southern Rockingham County area and serves 8 towns. Those 8 towns include Atkinson, Danville, Fremont, Hampstead, Kingston, Newton, Plastow, and Sandown. SoRock is a community organization, according to their website, which is a coalition comprised of several sectors of the community to work together to implement strategies and community change around substance misuse and mental health. Christine Duerr interviewed Charlotte Scott, the program director of SoRock, to learn what the program does, what the program offers, and how the program is funded.
My name is Christine Duerr, and I am here to speak with Charlotte Scott, who is the program director for SoRock, which is a program for youth to improve mental health. And this subject is very passionate to me because I have been a lifelong pediatric nurse, and I also worked at Children's Hospital, which is a center for inpatient psychiatric care. And I understand how important mental health care and services are for children in our community. So welcome, Charlotte.
Thank you for having me.
Let's begin by talking about what your background is at SoRock.
Yeah, so I've been with the coalition for, this is my 17th year, my 10th as an employee. Previous to that, I was just a volunteer member of the steering committee. My background prior to that was a little all over the map with marketing and domestic violence advocacy, bullying, and special education advocacy. So a little bit of everything.
Wow, that's very impressive. So tell me, what is SoRock? What services do you provide? And what is your mission?
So our mission is substance misuse prevention and mental health for the children, youth, and families of Southern Rockingham County. Mm-hmm. We're a community coalition comprised of several sectors of the community who come together for that mission. Mm-hmm. Mental health agencies and all the schools in the towns that we serve, youth-serving organizations such as the WISE, mm-hmm. So first responders. Mm-hmm. So we all come to the table once a month and we discuss the needs and the climate of the community and to address those 2 issues.
Mm-hmm. Do you also work with the police department,
Yep.
Teachers?
So first responders in schools, yes.
Yeah. Counselors at school?
Yes,
Okay.
We work collaboratively with the counselors from all of our school districts.
Great. That sounds like a very comprehensive team approach, multidisciplinary.
Absolutely.
So that's great that you have, all of these service areas working in conjunction, identifying issues and needs, and then working out a way to meet those needs. What would you say is the impact for Atkinson children with regards to how many children do you serve? What type of programs do you offer both out in the community and in the school setting?
So in the schools, as you said, we work collaboratively with the counseling departments and the administration to provide programs, assemblies. We provide technical support. We provide campaigns specific. We help our youth groups. We have youth groups in most of our schools that we co-advise to do campaigns around mental health and substance misuse prevention. In the community, we have parent support groups. We have relative caregiver support groups. We have we sponsor programs for parents on staying connected with their teens through New Hampshire Teen Institute. We work with first responders to get Narcan out to the communities. Mm-hmm. When they go out on an overdose call, we provide packets to leave behind. And as far as how many Atkinson residents we served, I'd say approximately, I think it's like 475 this past year between our school programs and our community programs.
That's great. Do you do programs in which the children themselves can assume a leadership role?
Oh, absolutely.
So, because that's a very effective way, for children to receive services from, leaders in their age group. So could you speak a little bit to that, please?
So we have youth leadership groups within the schools. So, for example, Timberlane, we sponsor their A Life of an Owl program. SoRock was instrumental in bringing the Life and Athlete program to New Hampshire first. So that program, an example of how we have those children lead. Recently, we did our mental health literacy program for ages 6 through 10 at Atkinson Academy in December or in January. And we brought our Life of an Owl students down and some of our peer outreach to do the reading part of that program with those younger children and to do their mental health plan, individual mental health plans with them.
That's great.
So we also have youth leadership summits that teach these kids how to be leaders in their community. We had 2 of those of our own last year that we sponsored, and we brought together all the schools and high schools in the area, I think 6 schools each time, even some outside of our catchment for that program, giving the kids those tools to be, the voice for change and positive impact in their community.
Yeah. Do some of the students form relationships with another student that might be identified as having some significant needs or could benefit from a supportive relationship with a peer?
Yeah, so we have programs, youth leadership trainings that teach kids the different tiers of pyramid of prevention is what it's called, where they they learn what is a peer-to-peer problem, what is a get a trusted adult problem, and what is a call 911 problem.
Wow.
So,
yeah, that is really a very effective way of providing mental health care to particularly adolescents because they relate so much better and closer with someone with their own age. And that's a
peer-to-peer is a huge piece of what we try to do. And, nothing for them without them. We need the kids generating the ideas and being the voice for how we do these programs.
Right. Right. That's very important for youth empowerment. Are there any cases or programs that you have offered that you feel really impacted a child's life or a school? What are your greatest achievements in your opinion?
I think everything we do in every place we go, we probably save at least one life. I think that's the best part of what we do, whether it's a conversation that we have with someone at a town day or a town event. That could be a parent whose child just got out of rehab and they're scared. It could be somebody who lost their child to an overdose and now they're raising their grandchildren and they're just immensely grateful that somebody's in the community raising awareness.
Right.
Or if it's a peer leadership where you see a student who otherwise would have been more reserved, step in front of a camera or step up or raise their hand to speak to something and to advocate for themselves and others. So, I think there's something everywhere we go and everything we do. We might go to a civic group meeting and have conversations there that have a ripple effect, throughout that person's family or maybe throughout the community or a conversation they have with somebody else down the road.
Right. I just want to address something that you mentioned for families who have faced a significant loss, such as a suicide or an overdose. For that family, a lot of times they want to reach out to the community to share, what a heartbreaking, experience this was and, the warning signs to look for. Is there a way that parents who have gone through such a loss can work with you to increase education
Absolutely.
And awareness?
Yeah, so I think coming to us is probably a great first step because there's a lot of safe messaging that needs to take place. There's a certain way to go about that so that you don't have unintentional increase
Right.
in an issue. I'm not even sure that was the best way to put that, but
Mm-hmm.
there's a certain way you need to deliver a message,
Mm-hmm.
especially
Agreed.
with something very sensitive like that. So I think starting with us, and then we can put them in contact with the agencies that we work closely with, NAMI, the American Foundation for Suicide Prevention.
Mm-hmm.
Those are the agencies that we work with very closely. And we will always turn to them. We're not the experts.
Mm-hmm.
We make the connections.
So if a child is identified or a family is identified at need, you can refer them to a counseling agency, a support agency, and to the community.
Yes, typically they'll be identified by school staff, and that school staff will make that referral, but we work collaboratively with the entire community so that maybe those school personnel know what those resources are,
Right.
and know of additional resources.
Right.
And we keep a collection of resources as well.
Right. Is there any financial obstacles to receiving services that you're aware of?
For our services?
So counseling services or some of the community agency services.
So some of the agencies have, like CLM, had a considerable wait list, and that they don't have a wait list for children right now. So it's very varied. It depends on your insurance. It depends on your region, what's available.
Right.
So
would there be a sliding scale fee that might
so we don't
to
do
families from the agencies?
I really don't feel comfortable speaking to what the agencies have available. But what we can try to do is to inform the parents as much as possible about the mental health, issues, how to communicate with their kids, what they might be facing. Some of the things we raise fund for are what's called the Parent Handbook by Operation Parent. Fabulous. It's a book that kind of has mental health issues, technology issues, substance issues, all in one place. And through our Parent Power Packs, we get resources like that out to the community. They also describe what's normal developmentally. I think sometimes a lot of parents get really anxious about some of their child's behavior and feel like they're failing when that behavior is is actually developmentally appropriate. And I think it's easier for parents to live in their own calm and not be as reactive if they understand that what that issue is normal development rather than a parental failure or their child misbehaving because of something else.
Yeah. Are there parent support groups?
We provide we don't provide parent support groups, but we do provide a class, as I mentioned earlier, called Staying Connected with Your Teen.
Okay.
That's a great resource. We try to advertise it as much as possible. It's 6 weeks, 2 hours a night, and we've done it typically at the Plastow Y because that's a nice central location for all of our towns. That's free of charge. We don't charge for anything we do.
That's great.
So, but that class, it turns into a support group of sorts.
Yeah. And then as they get to know each other, the parents can form individual relationships and continue it on their own and provides resources for each other.
And we're happy to support any parent support group out there that wants us to come in and speak or wants resources. So, we just need to know about them. And that's one of the things that we rely on our relationship with the community for is, let us know what's out there.
Right.
And we'll help put it all together in one place. So when someone needs something, we know where to send them.
Right. To help shore things up.
Yes.
Yeah. Who are you affiliated with? A lot of people had thought, because your name is so familiar, so similar to like a church, the Rock Church, and where you were called SoRock. Even I had heard that you're a religious agency. Can you speak to that? And
so clarify? I actually never thought of that until somebody mentioned it to me last year. So SoRock is just short for Southern Rockingham We're Southern Rockingham Coalition for Healthy Youth. We have no religious affiliation, although, the certainly a sector we want at the table would be religious and fraternal organizations because they're part of every community. So, and just like we want the police at the table, and just like we want the mental health agencies in the schools at the table. But no, we have no religious affiliation.
Great. Thanks for that clarification. Could you speak to your relationship with the police department? Because that's a very key issue in working with adolescents, particularly around substance use. Can you speak to that?
So we, as I mentioned, we try to work as close as we can to all of our police departments. As you can imagine, we have 8 towns, and between the staff rotation and all of that, we have our challenges. But we do have a relationship with all of our police departments to some degree, and we consult them when we have a concern that is in their area. We provide overdose prevention power packs to our departments to leave behind with the community members or families after an overdose. That would include Narcan, family support resources, substance use disorder resources for recovery, social determinants of health resources, anything you can imagine. And then we also support the DEA Take Back Day. And we've helped many of our towns get the permanent disposal boxes placed in their PDs. So I think 5 of our 8 towns now have permanent prescription drop boxes. So it's fabulous. We bring the PDs the supplies for the biannual Take Back Day twice a year from the DEA, and we promote that Take Back Day as well. Right now, we're working with all of our police departments to identify a location in our towns for a nalox box, which is a overdose rescue station that would be mounted indoor in a location where maybe they might see the highest rate of overdoses.
Right. I'm also aware that you do a lot of education with supportive family members like grandparents, educating them, to make sure that drugs that could be abused, are put away, not easily accessible, maybe even getting a small medication safe for them. And just being aware of medications that could be misused.
Yeah, so we educate across the lifespan, parents, grandparents, lock it up. We have a campaign right now that's called Walk, Talk, and Save a Life. And we distribute locking medication containers. Firearm trigger locks.
I saw those,
Narcan, overdose reversal kits, and medication disposal pouches. So if we are speaking to a senior population, we might bring the medication disposal pouches and some locking medicine containers. For speaking to parents, we'll do the same. Most everything we go to, we bring firearm trigger locks just to make sure that we can reduce that lethal means in any household. From a situation where someone's doesn't look for a permanent solution to a temporary mental health state.
And I became aware of the fact that you can get these items at the police station in the front reception area.
We have left some home safety kits with the police department in that, and they have them in that front area. And that has a trigger lock, locking medicine container.
Yeah, because I went in there for another reason to, drop some medications off, and I saw the resources there that people could help themselves to, which is great because a lot of people do use the police station for medication drop off. And so having those materials available, the items, the safety triggers, medication locks is a great way to access those items.
We've done some other campaigns with the police departments around underage drinking and safe prom messaging and things like that.
That's great. Having said that, if a child, is in trouble with the law Do you work with them in any supportive way?
We don't, but we can help find, some diversion programs or some, resources that might be related to whatever act they committed to, help find some meaningful consequences to redirect. So, yeah, we will work with local diversion programs.
Yeah.
Family mediation isn't in existence anymore in Atkinson, but there are similar programs.
Oh, okay. That's good to know. How would they access those mediation programs?
We could connect them to those programs.
Okay.
The police departments pretty much know what's out there.
Okay.
They have juvenile justice people that will refer them.
Great. Yeah, because I know that the police department has spoken very highly of the services and cooperative relationship that the two of you have. So
yeah, we have a good relationship with our police departments. We're proud of that.
right.
So
Yeah, it's so key.
yeah,
really
it is.
Yeah. Moving on, funding is always an issue to get these critical services. And nationally, more and more people realize just how important mental health services are,
Right.
For our youth. Can you speak to the sources of your funding?
So SoRock started as a Drug-Free Communities grant recipient, which is a federal program. It's designed to create infrastructure within your community so that you can then take it over and create sustainability within your own region. SoRock was a DFC recipient for 10 years. We graduated the program and then had to find a way to sustain ourselves. We did have a 1-year gap in funding. It's released in 2 5-year increments. So that gap was a little more detrimental than, if somebody had gone continuously through the 10 years. During that gap, we lost our office, we lost our staff. We had a skeleton volunteer staff during that time. So we had to do everything, kind of start over in our second round. But we were not a year 1, we were a year 6. So we didn't have as much time for that momentum. Also, that grant, I should mention, is $125,000 a year for 5 years. And you're required to generate a community match to that amount.
Okay.
And that's how they expect you to then sustain yourselves with those relationships, financial relationships developed during that match. So it's a little harder when you have 8 smaller rural communities than it is when you have a city.
Right.
A lot of times a hospital will pick it up, a youth serving organization will pick up the fiscal agency, or a municipality.
Right.
We don't have the ability to be absorbed by anything like that in our towns. So what we decided to do is go to our 8 towns and ask for $1 per person based on population to help sustain us.
Right.
And that varied, as you can imagine, for the different population levels in our towns. So we are sustained a good amount through our town funding. The governor has also put us into the budget for all 4, I think there are 4 graduated DFC coalitions in the state of New Hampshire.
Okay.
And he's included each of us for $50,000 a year for 2 years. The only downfall to that, it's great funding. We're super excited to have it. It's going to be a huge weight lifted in some ways, but it's a reimbursement model. So we have to spend the money and get reimbursed for the money. So it's a little different.
Right.
No one's cutting us a check for $50,000 up front.
Yeah.
SoRock has a fiscal agent,
Uh-huh.
Which is a model similar to what's used by the public health networks in the state of New Hampshire. Our fiscal agent is the Southeastern Regional Education Service Center. Their acronym is SoRock. They provide school psychologists, behavioral health personnel on a subcontract basis to the schools in the state. That fiscal agency saves us from having to hire an accounting department and payroll and liability and all of that.
Right.
So that's why we have them. And right now that's how we're funded with in addition to fundraising, sponsorships from our public health networks for projects, sponsorships from Exeter Hospital, local personal donations, civic group donations. We have a whole bunch of different types of funding, but it's always changing.
Right.
You know, the levels are always moving.
Right. Well, it's very key that communities make the commitment, both in terms of time and funds, to serve our children who are at need. I mean, it's such an undermet need, and it really requires the commitment. Like as I said, on a personal and financial basis to make this work and get the services out to children who are at need.
And we want investment from all of our communities, not just financial, but we want them at the table.
Yeah.
We want to hear from people. We want people engaged. We want people to come to our meetings.
Right.
And if you can't come to our meeting, I'll meet you for coffee in the community if you have a community concern.
Right.
We are here for everybody in the community across the lifespan. So.
Right. And just so residents understand, what % of funds actually go for services?
90% of our funds go to our mission and 10% go to our fiscal agency fees, which is administrative fees.
Mm-hmm. So essentially almost all of the funding actually goes for services and improving mental health care.
So I don't want people to think that we're a mental health service organization where, we leverage mental health resources and services for our community, and we bring different programs in, but substance misuse prevention as well.
Mm-hmm.
And part of that 90%, does include my part-time salary, but my entire job is the mission of the coalition. So, and I would say we still are leveraging at least $100,000 in kind resources from our down to our communities that we don't, physically write a check for.
Right.
So it's donated services. My office space is donated. A lot of our programming is stuff that I get donated. So.
What do you think are the biggest misconceptions about SoRock?
I think that, that our funding goes all to administration. I think that has been brought up locally as a concern. But again, the only real administrative costs are, the things that any business would have for overhead. And the rest of it goes to the mission. And like you said, I think another one was the religious piece of it.
Right.
And I don't think people understand that we're an across the lifespan organization. We don't only serve youth. We serve parents. We serve grandparents. Because you can't have healthy youth without a healthy community.
Right.
So everything we do is grassroots, and it's all relationship building.
Right.
With all of our communities, and they're all they're all different.
Right.
We have eight small communities that operate very differently. And have a different demographic to some degree. So.
Right. So over the 17 years that you have been with SoRock, what do you think are the best, what are the biggest achievements that SoRock?
We're still here.
There you go.
I think our biggest asset is that we are able to stop and pivot depending on the needs of the community. If we're doing a big drug prevention campaign and there's a suicide in one of our towns, we can stop and pivot and make sure that we're able to address the needs of that community based on that incident. Same with any other, situation. And that's a nice flexibility that we have had since aging out of that grant, which was very substance misuse prevention focused. It was very substance specific.
Right.
And we know that substance misuse is driven by mental health
Right.
issues.
Anxiety, depression,
So all of the above.
poverty.
Right. And as you mentioned, we do have quite an issue right now, especially with our young people, where almost half of the young people in this state have, reported feeling sad or hopeless for almost 50% of the time.
Right.
Almost 50% of youth for, 2 weeks or more have not wanted to participate in things they normally enjoy.
Yeah, it's mind-boggling. Yeah, it is a big impact on our kids.
Right. And they're turning to substances to deal with those. So
Right.
our hope is to, address things younger. Another bonus to not being restricted to some of that federal money that confined us to middle and high school is now we can work more with our elementary schools, which we love.
Right.
And to do this mental health literacy with these younger kids and to start this conversation early and to teach them how to deal with their feelings and move through them and that they're okay.
Right.
Instead of a culture of avoiding.
Exactly. I mean, difficult feelings, anxiety, depression, no one wants to feel those feelings. So therefore, it enters into self-medication because you want to blotto that out. You don't want to go through that. And it takes a lot of courage and support to go through those difficult feelings and address, how to meet your needs in a healthier way.
Right. We kind of encourage parents to help their children through adversity and complex feelings instead of around them and avoiding them by problem solving for them.
Avoidance. Yeah, that's the number one reason for substance abuse. Blotto those difficult feelings out and uncomfortable ones.
Right.
What do you think are the biggest obstacles to meeting mental health needs in small communities?
I think our biggest obstacles to reaching people is just everyone's so busy. When we have these events and when we have these workshops, they're not always well attended.
Right.
So it's meeting people where they're at. I'm trying to go to existing meetings and existing groups as much as I can and kind of bringing the message to them instead of adding to people's plates.
Right.
Another thing for them to come out to. And sometimes there are things that we do want them to come out to.
Right.
Another challenge is reaching the families that don't have the means to get to our events, or they're working in the evenings, or they simply don't have the motivation to go. And that's where we need to be the most. So I think that's the biggest challenge, is reaching the people that need us to reach them the most, and finding creative ways to do that.
Exactly. Well, that's why we are here today, talking to you, putting this on the Atkinson TV channel so that, we can reach persons on a more convenient basis, watch this at any time of convenience and that.
We appreciate it.
Yeah.
I want people to know that they can pick up the phone, they can email us, they can go to our website to contact us through there, and I'll answer any of the any question. No questions silly, no questions too small. I'd rather the accurate information be out there so people understand who we are.
Exactly.
Because we are a community resource and we're a valuable community resource. And I want people to know we're here to access.
Is there anything that you would like to say at this particular point in terms of like the best way to reach you? Do you have like a website or?
SoRockNH.org.
Okay.
Is our website. And if you email straight from there, it'll come to me.
Oh, good to know.
And if I reply, my phone number's on there and feel free to use it. We have a lot of scary things coming down, this way, with the high THC levels in marijuana, causing a lot of first-time psychosis, increasing, triggering schizophrenia in adolescents that may not otherwise have, activated, recessive gene from family history. But we're having, a rise in psychosis in people with no family history, kids with no family history now. So we just don't have the the studies, the long-term studies don't exist on these high levels, and they're extremely dangerous. This isn't Woodstock marijuana that we're dealing with. It's very different. So there's a lot of risks with commercialization that we've discovered from Colorado, and I just spent a week in DC hearing from Canada as well. But we have a fake pill problem right now. We have the cartel flooding social media with
Counterfeit prescription.
Adderall and Xanax.
True.
That isn't real. And those pills are loaded with fentanyl. And one of those pills can be deadly. Right now, 7 out of 10 of those pills seized by the DEA have a lethal dose of fentanyl in them.
Right. And on a young developing brain, its impact is so much worse.
Well, the fentanyl levels, it's one pill will kill them.
Exactly.
So it's, it's not even so much just a matter of, hooking them. And, they have no idea if they get that pill from a friend, if the friend bought it on Snapchat.
Right.
And, like again, 7 out of 10 pills in the same bottle could be deadly.
Right.
And there's no real medication in there.
Right. And it's accessible online. This can happen, in their room quietly, and you might not even be aware that, this is being accessed.
I'm encouraging parents to keep Narcan in their house.
Right.
The adolescent brain is impulsive.
Exactly.
And,
I think they're invincible.
It's not about being a good or bad kid. It's just, you can't make a mistake anymore.
Exactly.
Without, really high consequences. So really the only ammunition we have to, both the mental health and substance misuse and fake pills and all of these dangers that are out there is education.
Exactly.
And information sharing. So I'm the resource, or the coalitions in the state, we attend the state meetings representing our towns. We attend the federal meetings representing our, communities, so that we have the current information and we have the current resources to do our best to work with our communities to keep them safe.
Right. It's so important. Charlotte, is there anything else that you would like the community to know that I haven't asked you that you would like to highlight?
Just, again, we're here for everybody. So don't hesitate to reach out.
Yeah, great. And that's very important.
Yeah.
If any of you in the community have questions about services, as Charlotte mentioned, please reach out, contact them through the website, give her a phone call, do your fact gathering. There's a lot of really good services for youth available.
Our 2023 highlight year in review is on our website on the homepage.
Oh, great.
So if you want to see some of what we did in 2023, it's available right there.
Great. That's good to know. That's a great fact-finding place.
Yes, absolutely.
To get your information too.
A 22-page document of the highlights from last year. So
Great. Yeah. Some reading material then.
Yes. But you can move through it quickly.
Yes, exactly. Well, Charlotte, it has been great talking to you, and I wish you well. And again, please educate yourself about the services, and don't be shy about getting your questions answered.
Yeah.
And thanks so much, Charlotte.
Yeah, thank you for having me.
The Atkinson Gazette is an independently produced program delivering information, interviews, and events in and around Atkinson. For more information about this program, you can go to facebook.com/Atkinson Gazette, or you can find this clip and many other clips on YouTube at Atkinson Gazette.